Most people believe the heart rests during sleep. Doctors know that's not true. At night, blood pressure naturally shifts, heart rhythm slows and adjusts, oxygen levels can drop unexpectedly after 60. The heart becomes more sensitive to nighttime stress. Even small habits can cause damage over time. The nighttime habit. Doctors keep seeing cardiologists report one habit appearing again and again in senior patients. Sleeping immediately after eating or drinking heavy evening meals. This includes late dinners, sugary desserts before bed, salty or processed foods. At night, large amounts of liquid close to sleep. Most seniors do this thinking it's harmless. It is. What happens inside the body while you sleep? When you lie down after eating, digestion competes with heart function. Blood is redirected toward the stomach. Heart workload increases. Blood pressure can spike unexpectedly. This strain is silent. No pain, no warning. Over months and years, it weakens the heart. Why this is more dangerous after 60? As we age, blood vessels stiffen, heart recovery slows, nighttime regulation becomes less stable. A habit that once caused no issue can suddenly trigger irregular heartbeat, worsen high blood pressure, increase risk of heart events. Doctors say age changes the rules. Early signs. SENIORS often ignore. Many seniors notice chest discomfort at night, shortness of breath while lying down, waking up with a racing heart, poor sleep without clear reason. These are not normal aging signs. They're often connected to nighttime strain on the heart. Why this damage is called silent? There's no sudden pain, no dramatic symptoms. The damage builds quietly until one day it's serious. Doctors call it cumulative cardiac stress. Doctors explain that the danger isn't the food alone. It's what happens when digestion, gravity, and sleep collide. When a senior lies down soon after eating, the stomach remains full, acid and pressure increase. The heart must work harder to maintain circulation. This extra workload occurs during a time when the heart should be recovering. How blood pressure becomes unstable. Normally at night, blood pressure dips, heart rate slows, blood vessels relax, but late eating interrupts this process. Doctors often observe nighttime blood pressure spikes, irregular heart rhythm, increased arterial stiffness over time. This pattern damages blood vessels and heart tissue. The oxygen problem. Most people miss when digestion is active. Oxygen demand increases, breathing becomes shallower during sleep in seniors. This can lead to lower nighttime oxygen levels, increased cardiac strain, higher risk of arrhythmias. This is especially dangerous for those with high blood pressure, diabetes, sleep apnea, heart disease history. Why the heart can't recover properly. Doctors describe nighttime as heart repair time. Late meals delay recovery, prevent full relaxation, increase inflammation instead of healing. The heart stays in stress mode. Repeated night after night, this contributes to heart muscle thickening, reduced pumping efficiency, increased risk of heart failure. What cardiologists notice first in many seniors, doctors first detect elevated morning blood pressure, abnormal overnight heart rhythms, persistent fatigue. Patients often say, "I feel fine, just tired in the mornings." That's the warning stage. Why symptoms appear years later. This habit doesn't cause immediate collapse. It causes gradual damage. Tiny changes each night, accumulated stress, reduced resilience. By the time symptoms are obvious, damage has already progressed. Who is most at risk? Doctors highlight higher risk for seniors who eat after 8 p.m., regularly consume salty or processed evening foods, drink large amounts of liquid before bed, lie down within 30 minutes of eating. The good news. Doctors want you to hear. Doctors stress one important point. This damage is preventable. You don't need medication changes. You don't need extreme diets. You don't need to stop enjoying food. You only need to change when and how evenings are handled. The golden rule after 60. Cardiologists recommend stop eating heavy meals at least 3 hours before bedtime. This allows digestion to complete, blood pressure to stabilize, the heart to fully relax during sleep. For most seniors, this single change produces noticeable improvement within weeks. What a safe evening meal looks like. Doctors suggest light protein, fish, eggs, lentils, cooked vegetables, small portions, low salt. Avoid at night fried foods, processed meals, sugary desserts, heavy starches. The goal is nourishment without stress. What to do if you feel hungry late? If hunger appears later, doctors allow a small banana, a few nuts, warm milk, small amount. Never go to bed overly full. The liquid mistake many seniors make: drinking large amounts of water or tea right before bed. Increases nighttime urination, disrupts sleep cycles, raises heart strain, doctors advise. Hydrate earlier in the day, small sips only after dinner, the ideal nighttime routine for heart safety, cardiologists recommend. Finish dinner early, take a gentle walk, 10-15 minutes. Sit upright for at least 30 minutes, avoid screens and stress, sleep with a slightly elevated head. These steps reduce nighttime cardiac stress dramatically. When to talk to a doctor if you experience chest discomfort at night, waking with a racing heart, breathlessness while lying down, morning fatigue that doesn't improve. These are not normal aging signs. They are signals your heart needs support. The message: DOCTORS want SCNIORS to remember aging doesn't damage the heart. Habits do, and habits can be changed.